Morning, good afternoon, good evening. This study was the impact of COVID-19 pandemic on contraceptive access in the US. And I'm going to have to navigate around here a little bit. Changes in access to healthcare services experienced during the COVID-19 pandemic may have impacted women's ability to access contraceptive care, including long-acting reversible contraceptives. The objective of this study was to assess the impact of the COVID-19 pandemic on site of service for contraceptive care in the United States. The study design and method was a cross-sectional survey of women aged 18 to 49 in the United States who were currently planning or plan to be sexually active with a male partner. So in other words, subject to contraceptive care. Respondents were asked about in-person and telehealth services, as well as ease of filling contraceptive prescriptions. We conducted descriptive analysis for our variables. Overall, we had a sample size of 1,878 women who met all inclusion and exclusion criteria. The mean age was 30.8 years old with a standard deviation of 8.7 years. 76% were white, 14% Hispanic, of Hispanic ethnicity. 36% were married and 41% were single. 61% were commercially insured. And the bulk of our sample, 43%, had a BMI in the normal range between 18.5 and 25 kilograms per meter squared. I'm going to move over here. We asked about telehealth services and in-person services for discussing, prescribing, and filling contraceptive services. And what we found was the use of telehealth services increased during the pandemic relative to before the pandemic. Before the pandemic, 9.3% of respondents indicated that they discussed their contraceptive needs using telehealth, whereas during the pandemic, 1 out of 5 did. 20.5% of the respondents indicated that they used telehealth services to discuss their contraceptive needs with a healthcare provider. Now we move on to prescribing those contraceptives. Before the pandemic, 10.1% of respondents indicated that they used telehealth services. During the pandemic, 21% of respondents indicated that they used telehealth services for the prescribing of contraceptives. And interestingly, for filling, we have a slightly different breakdown of categories here. 10.2% of respondents indicated they used some sort of service that was not in person, whereas during, it didn't increase that much. Only 12.8% said that they used not in-person services to fill their contraceptive prescriptions. When we look specifically at the switchers, 22% of respondents actually had a full-on switch in the source of discussing and prescribing and filling contraceptives. And most switched from in-person only to telehealth only. So of those switchers, 22% wholly switched sources for discussing and prescribing, and only 10% switched sources for filling their contraceptives. More specifically, when we look at the pathway of switching, discussing their health, their contraceptive health needs, of those switchers, 53% switched to from telehealth, switched to telehealth only, and just under a quarter switched to a combination of both telehealth only and in person, so a combination. When we looked at prescribing those contraceptives, 61% indicated that they switched to telehealth only, and another almost 20% switched to both a combination of both telehealth and in-person. And for filling their contraceptive needs, these are the switchers only, 32% switched to a not in-person only service, and about a quarter kept the combination of both in-person and not in-person. And when we talk about not in-person, you'll notice that the language switches. We're talking about mail order, pharmacy, prescription websites, those kinds of services where you don't have to come to a retail site, a hospital site, or otherwise engage in person for filling. When we asked about ease of filling contraceptives, 20.3% of the respondents agreed that the COVID-19 pandemic affected their ability to renew or refill. And in fact, it became more difficult to renew or refill their contraceptive prescriptions. 19.9% agreed or strongly agreed that their ability to start a new and importantly, preferred method of contraception became more difficult. And 13.4% agreed or strongly agreed that they used a different contraceptive than they originally wanted, which is an important point to keep in mind as we move forward through the pandemic, that 13.4% said they used a different contraceptive than they wanted. When we come down to the additional results down here, about 23% of the respondents indicated they wanted to use a LARC during the pandemic. Of those, 38% of those potential LARC users indicated that their initiation of a LARC was impacted by the pandemic. A third had to wait or delay the insertion of their LARC. Another third had to have their LARC, their long-acting reversible contraceptive, initiated by a different healthcare provider. 28% had to go to a completely different office or location than they normally would have for the LARC. 16% were advised to use a short-acting contraceptive while waiting to begin a LARC, and that's important because that's a less effective form of contraception than the long-acting. And 1 out of 10, a little over 1 out of 10 LARC patients was advised to use a completely different contraceptive method instead. And so for conclusions, over here, the COVID pandemic affected the way in which women received contraceptive healthcare services, including access to the most effective forms of contraception. Up to 1 in 5 women had difficulty receiving contraceptive care. And as we move out of the pandemic, special care should be paid to women's contraceptive care. This care is disrupted, and we should be paying attention to that contraceptive care. Some limitations include that the self-reported nature of the data is associated with potential response biases, especially recall bias. We were asking about a relatively long period of time. However, when we talk about actual use of contraceptives, self-report really is the best source. And another limitation is the cross-sectional design, pre and post. Again, we were asking about a long time frame. And so with that, I just wanted to say thank you and open the floor to questions.